Nephrotic syndrome, glomerular disorder characterized by proteinuria. More than 3.5 gram per day protein is lost in urine that result in hypoalbuminemia. As we know that albumin is important for maintaining oncotic pressure. So low albumin will result in pitting edema, hypogammaglobulinemia, increases risk for infection, hypercoagulable state due to loss of antithrombin 3. Antithrombin 3 is important for breaking thrombin and destroying of coagulation factor, so it decreases hypercoagulability. Hyperlipidemia and hypercholesterolemia may result in fatty cause in urine. Minimal change disease. Most common cause of nephrotic syndrome in children, usually idiopathic, may be associated with Hodgkin lymphoma. Lipid may be seen in proximal tubular cell. Effacement of food processes, no immune complex deposition, so negative immunofluorescence. Selective proteinuria, loss of albumin but not immunoglobulin. Excellent response to steroids. Damage is mediated by cytokines from T cells. That one is epithelial cell or food processes of podocyte, basement membrane and endothelial cell. Normal food processes and abnormal food processes, flattening of food processes. Cytokine causes flattening of the food processes. Minimal change disease is commonly associated with Hodgkin lymphoma. Cytokine is released from T cells. Focal segmental glomerulosclerosis. Most common cause of nephrotic syndrome in Hispanics and African Americans, usually idiopathic, may be associated with HIV, heroin use, and sickle cell disease. Focal some glomeruli and segmental involving only part of the glomerulus sclerosis. Effacement of food processes, no immune complex deposition, so negative immunofluorescence, poor response to steroids, progresses to chronic renal failure. Normal and sclerosed. Sclerosis means collagen deposition. Focal segmental glomerulosclerosis. Membranous nephropathy, most common cause of nephrotic syndrome in Caucasian adults. Usually idiopathic, may be associated with hepatitis B or C, solid tumor, SLE, or drugs such as NSAIDs and penicillamine. Thick glomerular basement membrane due to immune complex deposition. Subepithelial deposits with spike and dome appearance. Poor response to steroids, progresses to chronic renal failure. Immune complex deposition underneath of podocytes. That one is dome or the deposits, additional basement membrane. That one is spike and that one is basement membrane. That is endothelial cell. Spike, dome, spike, dome. So it gives an appearance called spike and dome appearance. Membranoproliferative glomerulonephritis, thick glomerular basement membrane that gives an appearance called tram-track appearance. Due to immune complex deposition, it's divided into two types based on location of deposits. Type 1 subendothelial deposits associated with HBV and HCV. Type 2 dense deposit disease. Intramembranous associated with C3 nephritic factor. Autoantibody that stabilizes C3 converters, leading to overactivation of complement, inflammation, and low level of circulating C3. Poor response to steroids may progress to chronic renal failure. When mesenchymal cell sees a deposit, then it will proliferate cytoplasm and cut the middle of deposits, and so in this way it will produce two pieces of the deposits, and these two pieces will look like a tram track, means two lines of a track. That one is a deposition underneath The endothelial cell are subendothelial deposits. Type 1 and type 2, that is deposits within the basement membrane. That one is a basement membrane. That one is a podocyte. Type 1 is associated with HBV and HCV, while type 2 is associated with C3 nephritic factor. C3 converts C3 into C3A plus C3B. Diabetes mellitus. High serum glucose leads to non-enzymatic glycosylation of the vascular basement membrane, result in hyaline arteriolosclerosis. What is hyaline arteriolosclerosis? Hyaline arteriolosclerosis is caused by leaking of protein into the vessel wall, resulting in vascular thickening. Protein appear as being hyaline on microscopy. Major consequences of responsible for hyaline arteriolosclerosis is benign hypertension and diabetes. Glomerular efferent arteriole is more affected than the afferent arteriole, leading to high glomerular filtration pressure. Hyperfiltration injury leads to microalbuminuria. Eventually progresses to nephrotic syndrome, characterized by sclerosis of the mesangium with formation of Kimmel-Stell Wilson nodules. As inhibitors slow progression of hyperfiltration-induced damages. That is a mesangium with Kimmel-Stell Wilson nodules present in the mesangium. Systemic amyloidosis. Kidney is the most common involved organ in systemic amyloidosis. Amyloid deposits in the mesangium, resulting in nephrotic syndrome, characterized by apple green birefringence under polarized light after staining with Congo red.